again, it's Sharon. It's been a week and 3 days since I last talked to you, and I know I said I was going to come back after a week, but to be honest with you, it's been a very bad week. So I was just in too much pain to be able to talk to anybody. The day after I last videotaped, I woke up in the morning with a really large swollen bump around my incision. And I didn't know what it was. No one had kind of given me a heads up that this might happen. And because I can't drive and I can't really sit for long periods of time, we called an ambulance and I went to the hospital. Anyone who's been to the hospital in Canada lately knows it's a long wait. So we were there for a long time until finally a neurologist came, a neurosurgeon came down, and he was a right royal butthole. So, and told me, no problem, go home. So I had really no answers what it was. Fortunately, he had a lovely intern who came back after he left and told me that what I'd gotten was a seroma. So a seroma is an accumulation of plasma fluid around the surgical site. So my back was swollen up at the back. Looked a little bit like a bustle from the olden days, like the ladies used to wear the big skirts behind them. And we think maybe because of that seroma, there was increased pressure on the nerve, and I experienced some really intense pain. I've been experiencing some really intense pain over the last week. I told the surgeon that he wasn't my surgeon, it was another neurosurgeon, the one on call, that I had been experiencing pain. And again, he said, it's nothing, go home. So I was home for 5 days until I had an appointment to go in and get my staples taken out. And at that time, talked to the physician's assistant who helps my surgeon, and they increased my painkillers, doubled my painkillers. So I've been a little bit more comfortable this last week. So recovery's been hard. I know there's stories about people who get the surgery done and they are better the next day and ready to roar. That hasn't been the case with me. My first week was pretty good. My second week has been really quite hellish. So any of you out there who are also suffering, I just wanted to say I empathize. And what have I done to make it better? Drugs are good. I'm now taking a hydromorphone, 2 milligrams every 4 hours. I don't always need that, so sometimes I just take 1 milligram, but I definitely can't make it to the 6 hours, so I've increased the dose. I have been spending a lot of time in bed with hot packs on my my back, on my incision, warm compresses on my incision to try to bring the swelling down, because we think that the swelling is going to make, when that goes down, that's going to make a difference. And it has been going down, so I'm hopeful that that will be handy. I've been spending some time with my dog, Teddy, who's very helpful, and with this is my friend Oliver. Oliver is my bear that I cuddle when I don't feel well. So Oliver and I have been spending a lot of time together. And I know that when people do things on the internet, they often, look their best. So I had a shower this morning, first time in several days, did my hair. I thought maybe at the end of this video, I would just post a still showing you what it is that I normally look like over this last week. And I wanted to let you know that if you're struggling to be optimistic, I understand. I'm worried that this was a mistake, but I feel like I didn't have any options. I spent 15 months prehabbing, exercising, losing weight, doing all the therapies that I possibly could do, and the problem just wasn't dealt with. So I'm hopeful that things are going to get better, and in the meantime, drugs are good. Drugs are good. And I'm walking a lot. So I walk around my house in circles. My dog Teddy and I have some great games that we play when I walk around the house. So I have a pickup stick and I use it to throw balls for him, and he's quite happy because I can't take him out for walks because it's snowy and the paths are bumpy and it's a bit of a mess, and I can't sit long enough to drive to get to the mall yet. But I'm hopeful that will happen soon. Anyways, sounds like I'm complaining. I am. Hope wherever you are on your journey, you're doing well, and I will catch up with you in another week or two. Take care.